I'm indeed honored and privileged to be here today with all of you to launch Lautoka City as a tobacco-free city. Let me highlight the facts about smoking. It is very important for all of us to know this. Tobacco use consumption is the single largest cause of preventable premature deaths in the world. And exposure to secondhand smoke is a preventable cause of significant morbidity, meaning illness and mortality. When someone lights a cigarette, he or she only breathes in 15% of the smoke. The rest 85% becomes passive smoke. Thus, other people get exposed to the cigarette smoke even if they don't smoke themselves. Fiji, with a population of around 850,000, is typical of a small country struggling with the burden of death and disease caused by tobacco use. The Global School-Based Health Survey 2010 Fiji report showed that there appears to be a link between teenagers smoking themselves and being exposed to others smoking around them. Just over half the sample, 55.6% of the students reported that people had smoked in their presence on one or more days over the last 7 days. Additionally, 1/3 of the total number of students surveyed, 31.7%, reported that their parents or guardians used some form of tobacco. Among students who smoked, 1 in 5, meaning 22.8%, reported that they smoked at home. Overall, the majority of students, 80.6%, had learned about the dangers of smoking and tobacco in the classroom during the last school year, while about 2/3, meaning 69.9% of students, reported that someone in their family had spoken to them regarding the dangers of smoking. About half of the sample, 50.9% of the students, had seen a lot of anti-smoking messages in the media in the last 30 days, with a slightly smaller number, 46.3%, who were in favor of a ban on smoking in public places. A large number of students, 82.5%, believe that smoke from other people is harmful to their health. Preventing tobacco use in children and adolescents, reducing tobacco use in adults, and reducing non-smokers' exposure to secondhand smoke are essential public health objectives for communities. We can and should get together to create more awareness about the dangers. Most smokers begin tobacco use during childhood and adolescence, and nicotine addiction begins during the first few years of use. Major risk factors for tobacco use initiation among children and adolescents are perceptions that tobacco use is a common and normative peer and adult behavior, meaning that this is perceived as a normal behavior and thus accepted as a normal way of lifestyle, which needs to be addressed with serious concern. The perception has to change, and this is where we need public support, parental mentoring and guidance, and of course in the school system as well. Along with other health risks, I would like to emphasize it is known that Fiji is a sports-loving nation, and cigarette consumption will contribute towards the decline in their performance as well. Although recent studies have identified increases in tobacco use prevalence in populations of young adults such as college students, overall, if adolescents are kept tobacco-free, most will never start using tobacco. As the saying goes, nip it at the bud. I have always believed that it is easier to mold a child with good lifestyle habits than to do so with an adult. As parents and teachers, we must educate our children and instill in them the discipline and mental culture to refrain from starting such habits. The use of tobacco is relatively high compared to other substance use, and exposure to secondhand smoke may be an ongoing problem. It's a great matter of concern to the Ministry of Health and Medical Services, because if young people start smoking at a very young age, chances are that they will not be able to quit or give up smoking easily due to the onset of addiction to nicotine, increasing the risk of smoking-related diseases and eventual death. Since the government of the day is very committed to improving the lives of our people, Ministry of Health and Medical Services has established smoking cessation training for medical staff through NCD toolkit trainings and packet of essential non-communicable diseases, that's the PEN trainings. Furthermore, Fiji was one of the first developing countries in the world to sign and ratify the World Health Organization framework on tobacco control in 2003. The Republic of Fiji was also the first country in the Pacific to sign the Illicit Trade Protocol, ITP, in July 2013 to eliminate illicit trade in tobacco products. As a signatory to the treaty, the Republic of Fiji is committed to take steps to become a party through a process ratification of the ITP treaty and become the second country in the world to ratify this treaty. Furthermore, to that in April this year, the World Health Assembly in Geneva awarded Fiji, for the Ministry of Medical Health and Services, World No Tobacco Day Award for its commitment to tobacco control in Fiji. Over the years, Ministry of Health and Medical Services has declared 7 tobacco-free villages today. Also, there are currently 42 villages with declared tobacco-free community halls. And not forgetting that all government departments, including health facilities such as hospitals, health centers and nursing stations, are all tobacco-free premises. In addition, under the Tobacco Control Decree and Regulations, all workplaces to which public have access to public transport and markets are smoke-free zones. In its continuous drive to ensure good health for all Fijians, I must also point out that July, we're almost in the end of July, the month for Ministry of Health and Medical Services, with the theme, Don't Delay, Get Checked Today. Not only in July, why only in July? We should continue and get ourselves checked if we haven't done so. So please, get checked today should be your motto if you haven't get checked, if you have not yet been checked. Tobacco use is one of the 4 risk factors in NCDs. As for smoking and for nutrition, A, alcohol abuse, and P, physical inactivity, meaning SNAP. It is therefore fitting and most appropriate that Fiji is indeed recognized for trying to reduce and eliminate smoking as a cause of many premature deaths. The Ministry of Health and Medical Services is asking adults over the age of 30 who have risk factors to get themselves checked if they have not already done so. It is always good to know the truth and facts about our health and take appropriate action now. Otherwise, it will be too late. I'm proud that Lautoka City Council has taken this challenge in launching initiatives in tobacco control efforts to achieve tobacco-free status for the city, the sugar city. Smoking bans and restrictions are policies and regulations that helps ban or limit the consumption of tobacco products in designated areas. These include private business and employer policies, organization regulations, and government laws. Laws can establish minimum standards to protect workers in private sector workplaces, as well as ban or restrict smoking in public areas and workplaces. These places include public service vehicles, restaurants, cafes, retail shops, bars, nightclubs, sports tents, and of course schools. Smoking bans and restrictions are strongly recommended on the basis of strong scientific evidence. They reduce exposure to environmental tobacco smoke in a wide range of workplace settings and adult populations when applied at different levels of scale. These are from individual business to entire communities and whether used alone or as part of a multi-component community interventions. Tobacco control requires a multi-sectoral approach with community involvement and support. We must keep in mind that it is not only the government that has a role in combating tobacco issues. It is also you and me and our communities that have a role. And I sincerely thank everyone who have contributed to tobacco control efforts in Fiji, and also everyone here today for being part of this very important tobacco-free launching. Remember, everyone has the right to tobacco-free air. If you are a smoker, please quit now. And if you are a non-smoker, please do not start. Let's continue to work together and make Lautoka City a tobacco-free city and make Fiji a healthy place to live, leisure and age with grace and dignity. With these words, ladies and gentlemen, I have great pleasure in launching Lautoka City Tobacco-Free Initiative, and I wish this to be a very, very, very successful project. God bless you all. Thank you. Dhanyawad and Veena Bhavnagar.